Welcome everyone to the webinar series 2024 of the European Milk Bank Association EMBA, supported by Medela. Some welcome words from Natasha Jalou, Head of Medical Affairs Europe.
Good afternoon, everyone, dear participants. My name is Natasha Jalou. I am the Head of Medical Affairs Europe at Medela, and Medela is very happy to support EMBA in the transfer of knowledge. As you can see here, it's for us a very important point to support science, to support knowledge around mother milk, donor milk, milk banks, and of course, as a company, to listen to our customers and to turn science into care, what you are doing in your everyday work. And so I wish you a very good webinar with a lot of new insights for your work with moms and babies and families. A few words about the technique. Exactly, thank you. You will have the possibility during all the lectures to ask questions into the box where you can see on the right-hand side of the screen a question mark. So do not wait. As soon as you have a question, you can write it here and we will transfer it to the faculty so that at the end we will have a Q&A session. At the end of the webinar, you will also receive a certificate of attendance, and it would be very nice if you take a few moments, a few minutes at the end of the webinar to answer a short survey in order for us to improve our work and our offering in webinars. And now I will pass over to Professor Guido Moro, who will introduce the lectures. Thank you.
Thank you, Natasha, for your introduction. It's a pleasure to be here with you today for the moderation of this interesting Medela webinar. And there will be two topics today. One will be related to the virus transmission. And we know that the role of globalization and climate change in the emergence of new viruses in human milk and the potential risk of viral transmission to neonates is a topic of extremely high concern for the health, particularly of term infants and preterm infants. But the presence of a virus in breast milk does not automatically mean that this could be dangerous and this could result in the transmission of an illness. So this webinar will provide an overview to better understand this complex. The second speaker will provide an update on human milk banking in Europe, with focus on the state of European Union regulation process of donor human milk. So we will start with the first presentation now, and the first presenter will be Professor David Lembo. He's the head of the Laboratory of Molecular Virology and Antiviral Research at the University of Turin in Italy. He's a passionate microbiologist with extensive experience in virology and focus on virus-cell interaction and research and development of antivirals. Currently, he is the Dean of the Degree Program in Medicine and Surgery of the University of Turin. Professor Lembo is an expert and jury member at the European Innovation Council, a scientific consultant of several biotech companies and co-founder of two startups. Author of more than 140 publications in peer-reviewed international journals, Dr. Lembo is also inventor of several patents in the field of antivirals and nanomedicine. And today he will talk about viruses and human milk transmission or protection. Please, Professor Lembo.
Dear Guido, thank you for your kind introduction. Good afternoon to everyone connected, and thank you for attending this webinar on viruses, human milk, and breastfeeding. Let me share my screen. I hope you can see the screen full time. Can you confirm me?
Yes, Professor Lembo.
Okay. Okay, we can start. And in 1970s was established for the first time the transmission of viruses through breastfeeding. And milk was found to be a significant source of infection to mouse pups for Moloni leukemia virus, sarcoma virus, and mammary tumor virus. Other species of mammals showed later on a similar pattern of transmission of lentivirus, including humans and, for instance, HIV, as we will see later. However, this story most likely began more than 100 million years ago with the appearance of the first mammals. And this slide shows two primitive mammals that are feeding their puppies. In doing so, they are exposing them to the potential risk of viral transmission. And some of them could eventually die for the infections. But if one of these mammals would produce a milk capable of neutralizing part of the viral load or conferring protection, its offspring will have an evolutionary advantage. Therefore, the competitive interactions of mammals with viruses and other microorganisms has resulted in the development of unique characteristics of their milk. And as we know, the human milk is the wonderful result of this evolution. As you can see in this picture, it is a universe of molecular, biological, active components endowed with nutritional, trophic, and immunological properties. And we have been investigating the antiviral activity of human milk and identifying new protective components for several years. And in the rest of my talk, I will discuss which viruses could be present in human milk and which milk components could prevent their transmission, with a focus on the so-called emerging viruses. So to set the stage, let's start by answering this question. What are emerging viruses? The emerging viruses are those viruses that have newly appeared in a population, and these viruses were entirely unknown before causing an epidemic or a pandemic in humans. Typically, they originate from a spillover event. They have an animal origin, and they adapted to humans. And the prototypes of this group of viruses are HIV, SARS, and SARS-CoV-2. On the other hand, re-emerging viruses are those that have existed previously but are rapidly increasing in incidence, like Ebola virus, or in geographic area like West Nile virus, monkeypox virus, chikungunya virus, or Zika virus, just to mention a few. And all of them have exotic names, at least for us, because they were endemic in tropical or equatorial area. But now they have spread in other areas of the planet, including Europe and the US. I don't have time to discuss the reasons why for the increasingly frequent appearance of emerging or re-emerging viruses. I can just mention the most relevant one, such as demographic increase and urbanization, human and animal movements, deforestation, wet markets, and of course, climate change. Climate change may accelerate the spread of insect or vectors, typically mosquitoes, in different areas of the world. As a result of the combined action of these factors, a large number of outbreaks have occurred not only in the last 25 years, as you can see here, but also in the last few months, as you can see in this and in the following slide, reporting the most recent outbreaks of emerging viruses. Well, all these viruses belong to various viral families. Some of them are transmitted from human to human, while others required an insect vectors, typically a mosquito. Due to climate changes, these exotic mosquitoes have been able to spread in Europe, potentially facilitating the transmission of emerging viruses. And indeed, this map shows the current known distribution of Aedes invasive mosquitoes in Europe, the so-called tiger mosquitoes. In red, you can see the area where their presence has become established. And as a consequence, some viruses are becoming endemic in Europe. For instance, here you can see in red and in orange the spreading of Usutu virus in Europe. As you can see, Italy, France, Germany, and other countries reported autochthonous cases of Usutu infections. And this slide shows the distribution of locally acquired human West Nile infection till September 2024, so yesterday. Now, after describing the current scenario, let's ask what is the impact of this scenario on breastfeeding? And the first question we need to answer is, are there viruses in human milk? And the answer is yes. A number of viruses are able to spread from the bloodstream to mammary glands by crossing the so-called blood-milk barrier. The mechanisms are still under investigation, but several hypotheses could be put forward. Free viral particles, here in red, present in the bloodstream could sequentially infect myoepithelial cells in orange and luminal cells in pink of the mammary gland, resulting in the production of free viral particles in breast milk. Infected immune cells from the bloodstream, here depicted in blue, could cross the epithelial barrier via the paracellular route of the by the Trojan horse mechanism, resulting in the presence of infected cells in breast milk that could produce viral particles. The viral particle produced could productively infect luminal cells of the epithelium, resulting in the presence of both cell-free and cell-associated viruses in breast milk. Infected epithelial cells could also be found in breast milk after being split off the epithelium. And finally, it cannot be excluded that vesicle containing multiple virions could be produced by the mammary epithelium. Anyway, whatever the mechanism, the next question is, what viruses are present in human milk? And using molecular techniques, a long list of viruses have been detected in human milk, including emerging viruses like Zika virus, West Nile, SARS-CoV-2, yellow fever, dengue, Ebola virus, chikungunya virus. So up to 25 human pathogens has been detected by molecular techniques in human milk. But the two following relevant questions that need to be answered are they infective? Are these viruses infective? Well, 10 out of 25 viruses have been found in the form of infecting particles in vitro, including emerging viruses like dengue, Zika virus, and Ebola virus. The following question is even more relevant. Are these viruses transmitted via breastfeeding, causing clinically relevant infection in infants? Well, as far as we know, the transmission has been clearly demonstrated only for 4 viruses, namely human cytomegalovirus, HIV, Ebola virus, and human T lymphotropic virus. They have different transmission rates, but typically they have low transmission rate, but Ebola virus that has 78 to 86% of transmission rate. All the other have low transmission rates. And consequently, these are the recommendations. So suspending breastfeeding in the case of Ebola virus or HTLV, suspend breastfeeding for HIV in mothers in high income setting, but excluding breastfeeding for the first 6 months is recommended in resource limited setting. As for the cytomegalovirus, no recommendation against breastfeeding, but the risk to benefit ratio has to be taken into account in the case of very premature babies. Well, taken together, the data I have shown you so far lead us to an intriguing paradox. Many viruses have been detected in human milk, but few are transmitted. And those who are transmitted have a low transmission rate. How can we explain it? Well, from an infection disease perspective, the final outcome between health or illness depends on the balance of certain factors. On one hand, the pathogenic potential of a given virus, and put it simple, its ability to cause disease. On the other hand, the susceptibility of the host, and as you know, a preterm baby is more vulnerable to viral infections because its immune system is not yet properly developed. Moreover, an increasingly body of evidence point to a third factor, the protective properties of human milk. Indeed, in our lab, we demonstrated the in vitro antiviral activity of human milk against several viruses, including cytomegalovirus, human rotavirus, and respiratory syncytial virus, and against 2 emerging viruses like Zika virus and Uzutu viruses. This activity is the result of the combined action of many antiviral components of human milk, including proteins like immunoglobulins or lactoglobulin, lactoferrin, lactaderins, oligosaccharides, glycosaminoglycans, oxysterols, extracellular vesicle, and many others. But what are their mechanisms of action? Well, some of them exert their antiviral activity by blocking the binding of viruses to the cell surface. Others prevent the entry of the viral particle into the cells or inhibit viral enzymes. Some others directly interact with the viral particle, neutralizing its infectivity, like antibodies, or disrupting its integrity. Coming to open questions and future perspective, what is the knowledge we need to acquire as soon as possible if a new virus appears on the scene, as just happened for SARS-CoV-2? First of all, I think methods must be developed to understand whether the virus is found in human milk and whether it can be transmitted through breastfeeding. It is also necessary to understand whether milk has antiviral properties against that specific virus and whether pasteurization methods used in milk banks are able to inactivate it. And finally, it is necessary to assess the impact of pasteurization techniques on the antiviral properties of milk. Moreover, we need to investigate the transmissibility of the virus to the breastfed newborn, and we must carry out studies to assess the ability of the virus to cross anatomical epithelial barrier of the tonsillar, respiratory, and gastrointestinal tract, here depicted in green. And furthermore, we must understand if and how immune factors in human milk and those in infant saliva and gastrointestinal tract may interact synergistically to provide protective antiviral benefits. Let's conclude with the take-home messages. The first one is that viral transmission via breastfeeding is a rare event and is limited to very few viruses. Among emerging viruses, only Ebola virus is transmitted as far as we know. With Nile viruses, transmission is under investigation but seems to be rare. Human milk exerts antiviral activity against common and emerging viral pathogens, but let me point out that all the information, or most of the information we have so far, are produced in vitro. So we need to reproduce this activity in vivo. So in vivo studies are urgently needed to better understand this topic. And finally, new antiviral components are still being discovered, and more research is necessary to investigate their biological role in human milk. If you are interested in this topic, you may want to take a look at this review that we recently published in Advancing Nutrition. And to conclude, let me acknowledge the work of all the people that contributed to the research I presented. On the left, my group of virologists. On the right, the pediatrician and friends, Guido Moro, Enrico Bertino, Paola Tonetto, Stefano Sottemano, and the biochemists, Laura Cavallari and Marzia Giribaldi. And thank you for your attention, and I'm ready to take your questions, if any.
Thank you, David, for your very interesting presentation. I think that this topic will be discussed at the end of the session. because there are many things that should be clarified, and many people who are involved in breastfeeding and human milk banks are very anxious to know your answers. So, but now we switch to the second presentation. The second speaker will be Professor Sertaç Aslanoglu. She is the head of the Division of Neonatology and Professor of Pediatrics at Istanbul Medeniyet University. She is also a scientific coordinator and member of the board of directors of the Italian Association of Human Milk Banks and current president of the European Milk Bank Association. In her role as EMBA president, she advocates for an European Union regulation on standards of the quality and safety of donor human milk and set up specific EMBA working groups to drive improvements aiming to support the further development of European guidelines that create a legal framework for the use of donor milk in Europe. Professor Aslanoglu has conducted extensive research on neonatal nutrition, human milk, donor milk, and prebiotics, and has authored more than 120 scientific publications in peer-reviewed journals. The title of her presentation is Update on Human Milk Banking in Europe. Sertaç, the floor is yours.
You are muted, dear Sertaç.
Thank you very much, Guido, for this wonderful presentation. So my topic is update on human milk banking in Europe. I have to ask first, is my voice okay? Because there is a problem in my connection today. So please inform me if something happens. I have a B plan. Is everything okay?
It's okay.
Okay. So, good afternoon, everyone. Today I will speak about human milk banking in Europe and mostly the EMBA's position here. And then I will speak about European regulation on substance of human origin, which now includes also donor human milk. And then I will mention EDQM. Let's leave it now, then I will explain. Then also imagine HMB project and its importance in adaptation. So, as most of you know, human milk banking has a more than 100 years of history. It has been founded, the first human milk bank in Vienna by Theodor Escherich, and in more than 100 years, human milk banking has been integrated into uh, national policies which improves neonatal health. European Milk Bank Association has been founded in 2010 from 12 delegates and from 10 countries. It's a non-profit association. This is the founding members in Milan. You will know most of the members here. Our first president Guido, and the second is Gillian, and there are many friends here, many milk bankers. And as you see, the constitution, the primary aim is to promote breastfeeding. Then comes the donation of human milk and the utilization of donor human milk. As today, there can be a few differences because we are transferring our website to another domain, and we need to update soon our map also. But as today, as far as I know, we have 301 human milk banks. Italy was leading, but today Germany surpassed Italy with 45 milk banks, and then there's Italy and France, and then Sweden. So there are human milk banks in 28 countries. Some have more, some have less, and approximately 800 milk banks through the world. But of course, for us, not the numbers, not the quantity, quality is more important to ensure the safety and quality of donor human milk. And as you see, our constitution in 2010, we already planned or dreamed an international guideline or European guideline to set standards for practice of milk banking and to promote quality of donor human milk among member banks through adherence to guidelines. EMBA today is giving guidance also to the countries out of Europe, and it has working groups particularly aiming to ensure or to optimize the safety and quality of donor human milk. And of course, there are groups who are doing scientific research and surveys. And we also are organizing every other year an international congress and an EMBA research congress. We have now since 2 years, or more than 5 years, collaboration with EDQM. EDQM is the European Directorate for the Quality of Medicine and Healthcare and European Commission. Our working groups published in 2019 a recommendation for the establishment and operation of milk banks. This is guidelines group and processing group, donor human milk, processing of donor human milk recommendations, and 2 papers from fortification group, 1 recommendation, the other is the clarification of the fortification terminology. And last year, a survey about this is the maternal diet group. A survey came out about vegan and vegetarian diet, and this year the processing group published new alternatives to holder pasteurization. Of course, we are continuing. There are some active or soon to be active groups. This is prioritization of donor human milk, fortification of human milk, social and cultural aspects, and microbiology. So before passing to the European regulation, I will show you 2 of our surveys. One has been conducted and published in 2021, and showing that there's a wide variability in milk banking practices across Europe. The highest variability was observed in pasteurization practices, storage, and milk screening and microbial testing, as you can imagine. And the second survey is addressing the legislative framework of donor human milk. So, what is donor human milk? Considered as a food or product of human origin or a medicinal product? But only in 9 countries human milk has been defined, and 6 of them has defined as a food product, 2 as a product of human origin, and 1 as a medicinal product. The others didn't even define. So at present, there is a wide variability not only in milk banking practices, also in the definition of human milk, and there is no legislative framework in most of the countries except a few. For example, there is a law in France and in Slovakia, and regulation of the Ministry of Health in Italy. How human milk banking across Europe is being guided by national and international milk banking guidelines. And up to now, of course, there was no legislative framework across Europe also, you can imagine. These are some national guidelines published in English, NICE guidelines, 2023 Italian guidelines, Spanish guidelines, and this is the EMBA recommendations. So at present, what we need is harmonized European milk banking guidelines. Remember that we had planned it 14 years ago, but now we are coming, it will be realized in the next 18 months, I can say. So the story of the European regulation, I would like to check, is everything okay with my connection, dear Chairman?
Yes, it's
Everything is
okay.
good.
Okay, thank you. So, as we see the previous legislations on the safety and quality of substance of human origin, for blood and plasma, there is European legislation since 2002. And for tissue and cells, there was legislation since 2004. Euro, and for the organs, solid organs also, there is a separate legislation. So three different kinds of legislation. And European Commission evaluated in 2019, started before but published in 2019, this blood, tissue, and cell legislation. And what they concluded is that the legislation effectively increased the level of safety and quality of blood, tissue, and cells across Europe, but the current rules are no longer up to date. And key oversight principles are not sufficiently robust. Oversight principles, I mean inspection principles. The legislation does not keep pace with innovation, and requirements are insufficient to support sufficiency and sustainable supply for blood, tissue, and cells. So, what they decided, they merged this blood, plasma, and tissue cells legislation into one legislation called as substance of human origin. So they started to work. And at that time, the EFCNI, European Foundation for the Care of Newborn Infants, the president is Silke Mader, they published in 2021, but of course they started to work before. Some of the EMBO board members will remember these initiatives. And ESCNI has been one of the driving force to include donor human milk into this new regulation. They built on this momentum and then formed an international working group, including EMBA, to advocate for the inclusion of donor human milk in the Human Tissues and Cells Directive in this regulation. So, international and interdisciplinary experts in the field of human milk came together, but there was COVID in that period. These initiatives began before COVID, but then COVID started immediately. So there have been two digital roundtable discussions, and some recommendations have been prepared by this working group. And then the European Parliament hosted a workshop, and the decision has been taken. Donor human milk has been included for this regulation, and for the first time has been named as a SOHO, substance of human origin. So in 2022, July, the proposal of the European Commission was ready for the Parliament and, to the Council, and it has been published. And EMBA and other scientific associations um, sent some comments and made a statement because there was a little bit inconsistencies, or donor human milk terminology was not very well underlined. So EMBA and other associations uh, underlined that this regulation must be to cover specifically donor human milk and not mother's own milk. So, because lactating mother, the mother's own milk is not a donation, but is for the own baby. And there have been many virtual meetings also with between EMBA as stakeholder and with European Commission Directorate for SOHO. And finally, 2 years, it's about 2 years later, the regulation was ready and has been presented in the European Parliament, and in July 2024, it has been published in the official journal of European Union. And this European regulation has been launched in Brussels by European Commission on 24th of June. EMBA has been invited also to this European Commission conference. I put there the names of, because it was a moderated panel discussion, and I put the names to show you that how milk is being considered as one of the substance of human origin. So European Society for Human Reproduction and Embryology, International Plasma Fractionators Association, Plasma Protein Therapeutics Association, uh, and fecal microbiota. So there are two new SOHO. One is donor human milk, the other is fecal microbiota transplantation. So it was an historical day because now it has been, for the first time, donor human milk has been considered as a substance of human origin and was regulated European-wide. Here you will see two ladies. One is Silke Mader. She is very happy without any concern because her initiative has given a result. I am happy too because yes, it will of course ensure the safety and quality of the product, and also for the donors and recipients. But I'm not as clear smiling as her because also I have some concerns, as you can imagine. So in this regulation, it is also very positive, and we are happy to see that also our criticism worked, because it's saying that is Article 27. One's own, while the donation and banking of human breast milk should be regulated, feeding of one's own child with one's own breast milk should not fall within the scope of this regulation. However, yes, so mother's own milk is not in the scope of this regulation. But if it is pasteurized, in the healthcare units or milk banks, then this regulation should apply. So the new regulation is online. You can find in the website of the European Commission. This is the link I wrote to you. You can download from here. There are in many languages the regulation. And also, so what happened? It has been published in July. So that means the regulation entered in force. And after 20 days of publication, it will enter into the force. So it is expected now in 3 years, all milk banks become adapted to the new regulation. So by summer 2027, supposedly. So EDQM, I mentioned about EDQM. EDQM is a European Directorate for the Quality of Medicines and Healthcare. And it is experts working, it is composed of experts, working parties, committees, and staff. And among many duties or many products, they also produce guide to the quality and safety of tissues and cells for human application. It seems that many things started in 2019. Of course, the thought was before, but also for the first time from EMBA, it has been asked to write a chapter to this guide about breast milk. At that time, it has not been considered a SOHO yet, but a breast milk chapter has been prepared by EMBA components. And in the new regulation, why am I speaking about EDQM? Because new regulation is not like a detailed guidelines. It says, of course, it should be stored or it should be monitored, but it doesn't say how, in which temperature, for how long. So in the absence of union legislation describing particular procedures to be applied and followed to meet the standards set out in this regulation, following the guidelines of the European Centre for Disease and Prevention Control and the EDQM should be considered as a means to demonstrate compliance with the standards. So EDQM chapter will be very important now because for the details that are not written in the regulation, EDQM chapter will be considered. And this year, more EMBA members are included. Also, there is a Spanish Association of Milk Banks and the EDQM staff, of course. It is being updated, almost ready, and it will go to the stakeholders soon. And finally, imagine human milk bank, or imagine HMB project. 1 year after the publication of the European regulation proposal, a European Union call has been launched for a project. So action grants on the safety and quality of new substances of human milk origin. A is for breast milk and B for fecal microbiota transplants. So what EMBA did with its partners, prepared a project and applied for this call. And after, I think, approximately 6 months, so in the beginning of this year, it has been approved by the European Commission. So EMBA is co-founded by the European Union. We started as an Imagine project. This is our logo. So Imagine is implementation of human milk harmonized guidelines for infant nutrition in Europe. But then we came to know that there is another Imagine project. So it has been specified with HMB, that's a human milk bank. So what is this project? Imagine HMP is being coordinated by EMBA in collaboration with the consortium partners, the Polish Human Milk Bank Foundation, German Human Milk Bank Initiative, Spanish Association of Human Milk Banks, and the Irish Neonatal Health Alliance. And we have, I thank to all of the names here. There will be more, I'm sure. All the scientific associations, national milk bank associations, and other associations gave us letter of support in the beginning, in the writing of the project. So these are our stakeholders for now. And objectives of this project, I will not go through the details, but just will tell the objectives. First, the creation of an expert forum on human milk. The project has been launched 1 month ago and on 10th of September in Milan. So we assigned the tasks to the group members, to the consortium, and we already had our first steering committee meeting in October, in the beginning of October, and all our expert call proposal is almost ready. We will open an expert call soon. So what is the other objectives? To prepare two sets of guidelines. One guideline is for the established human milk banking guidelines, establishment and operation of human milk banking. The other is oversight, for the oversight requirements for inspection, how the human milk banks must be inspected. The other set of guidelines is this. And then there will be an implementation plan to implement these guidelines. And then I like this very much. There's a post-project strategy because we formed the expert forum. So this expert forum also will be ready or will be available if they like for the future updating of the guidelines. And also there will be the sixth task is agreed training program, including necessary digital tools. You see the management structure of the Imagine project here. So there's a steering committee, there will be an expert forum, and the task leaders, the work package leaders, and we have, as I showed you, 6 work packages. How will experts prepare the guidelines? Of course, the consortium will make an extensive literature analysis, then will guide the experts to draft the guidelines. Not only for Imagine project, of course, also European Commission is supervising us each time we have the Directorate of SOHO of the European Commission. We have close contact with them, and an officer of the agency is also helping us or supervising us. They want, also it's very plausible because it is written also in the regulation, the Imagine guidelines have to be in line with EDQM guide. So we have a direct connection with them. Also, there are other projects like GovPro project and égalité, all related to SOHOs. We have already a connection with GAPRO project for a risk analysis, risk evaluation tool preparation. And we will get into contact with Egalite team. So this is the timeline of the human male considered as SOHO. It's very a short time. Many things happen in a short time. When now we are here, Imagine project started. European guidelines will be ready by the end of February 2026. And EDQM chapter, I hope also will be ready by that time. So at the same time, WHO also is preparing human milk banking guidelines, and some of our EMBA members contributed to the systematic review that they asked, and some of our members also are involved in the preparation of the guidelines. PAT is a very important organization, always supporting human milk banking, and as EMBA members, we have connection also with them. So my last words for today, of course, some reflections and conclusions. There are knowns, but unknowns as well. But knowns are more than unknowns, fortunately. This is an historical moment, an achievement. Yes, it's bringing some concerns, but all milk banks have now 3 years to adapt to this regulation. And both EDQM and Imagine guidelines will be helpful in this transitional period. So please download first and read the regulation. And please note that EDQM guide and Imagine project guidelines will be important in adaptation. As I told, the call for expert will be open in EMBA website soon and in the social media accounts. We are transferring to EMBA website to another domain, so please bear with us for a couple of weeks. And I tell, join us in designing the European guidelines in expert forum and follow our updates. Thank you very much for your attention. And I announce here also our upcoming International Congress in October, which will be in Venice. Thank you.
Thank you, Sertas, for this very exciting and stimulating presentation. I think that we are in front of a revolution in the field of human milk banking. So many people will remain astonished listening to your presentation, and I think that will be a lot of questions. So now,
Revolution is the correct word, Guido. I will use this.
so we can start the question session now. I have already question from the audience. The first question is for Professor David Lambo. David, one question is, there are viruses that can survive older pasteurization?
Well, as far as we know, most of the viruses are disrupted by pasteurization. Sometimes we have problem to demonstrate their susceptibility because, to demonstrate that the pasteurization method works, we have to have the virus and to put the virus into the milk and use the pasteurization techniques. So for most of the viruses, we have information, I would say, or we will have very soon. We remember what happened with SARS-CoV-2. So we had to learn how to cultivate SARS-CoV-2 and then to prove that it could be destroyed by pasteurization.
Thank you. Now there is a question for Sertac. What is the difference between regulation and guidelines in this case, and how do you make sure that guidelines are also implemented in the real world?
Okay, I have a very good question. Regulation is legal, so it's a legal framework, and it binds all the European members. But guidelines is more a technical guide, uh, but to tell guidelines, of course, all have to be based on evidence, so scientific evidence, and they are completely different. But for example, also this regulation will let the nations to use their guidelines if they are compatible with EDQM or with the competent authority. And so how will I be sure that guidelines are being implemented? Was that the question? Yeah. Yes, this is a very good question because the most important thing is the implementation, of course. But European regulation, in this regulation, oversight, so inspections, I can say, they give very important. So when all the milk banks will be registered as tissue establishments or entities. It is not very clear, but I understand as tissue establishments. And there will be inspections. So it will be implemented because there will be inspections. But before that, as this is the legal part, but as Imagine project, we have an implementation plan too, and we have a group which will work on this. So with the meetings, with online training material, with surveys, uh, it will ensure implementation in the context of Imagine project.
Okay, thank you, Sertac. And now another question for Professor Lembo. David, among the various components of milk that you have studied, antibodies are the most important?
No doubt they are important. They are very important factors, but they are not responsible for all the antiviral activity of milk. A few years ago, we published an article on the antiviral activity of milk against cytomegalovirus. And in that study, we collected colostrum and mature milk from seropositive and seronegative mothers for cytomegalovirus. The colostrum from seropositive mothers were more active, but those for seronegative mothers still exerted antiviral activity. Moreover, mature milks added the same activity. And furthermore, colostrum from seropositive mothers, if immunoglobulins were depleted, maintained an antiviral activity, albeit reduced. So these are other data indicated that immunoglobulins contribute to the overall antiviral activity, but they are not the only antiviral factors. There are many others, and we have studies also other factors. And this is important, because seronegative mother provide protection to their children, even if they have not been exposed to the virus.
Okay, clear. Thank you. Now, a question for Sertac. There are some specific milk banking practices which you think would be more difficult to harmonize throughout Europe?
Yes, this is a good question too. Yes, surely, because there are some issues, some topics, or some fields in the milk banking procedures. There is the highest variability I showed in my slides, particularly screening of donors and pre and post pasteurization, microbial testing. These, I think, this will be the most challenging issues, because everybody is doing different thing, but and the guidelines also in the EDQM, we have to do harmonized one thing. So this can be difficult, the challenge, the areas, and also
Okay.
pasteurization.
Also, excuse me. Also,
Also, pasteurization is more. How can I say, more holder pasteurization is being used extensively, uh, but towing or storage, these can be different too, but I think more microbiological testing and screening.
okay. Okay. Now another question for Professor Lembo. Avian influenza represents a potential pandemic risk, and recently there has been news of its spread to several species of mammals, including cows. Is there any data on the transmission of this virus through milk?
Thank you for this question. It highlights a very important concern. The problem here are the highly pathogenic avian flu viruses. These are viruses that normally replicates in birds, and we are talking about H5N1 subtype. But now they are of great concern due to their increasingly spillover into mammals. Nowadays, for instance, currently, there are many cases of dairy cattle infections in the US, if I remember correctly, in Texas and in Kansas. And the bad news is that the virus has been found in their milk. And even worse, domestic cats fed with unpasteurized colostrum and milk from the affected cows developed fatal systemic influenza, thereby proving that the virus is transmissible with cow milk and underlying cow milk. The US Food and Drug Administration has indicated the commercial milk supply remains safe because of the pasteurization completely inactivate the viruses. As for humans, as we know, human cases are very rare. We have few reported cases, so we don't have information whether or not avian flu viruses can be transmitted by breastfeeding. However, the data from other mammals are of great concern, and we should be prepared to face this problem.
Okay, thank you. Now there is another question for Sertac. Thank you for nice presentation. I would like to ask Sertac Arslanoglu. First, what do you think about the new methods for milk processing, such, for example, high-pressure treatment? Second, there exist a lot of breast milk collection centers which have not a statute of milk banks, but they will have to receive new rules. I think this can lead to decide the closure of these centers, and new banks should be founded. What is your opinion about this? So, two questions.
Yeah, thank you for the interesting questions. Yes, the new, of course, treatment or processing methods are promising. There are two more promising, I can say. One is the high temperature short time pasteurization. There are already, as far as I know, two devices, one maybe more, but one is in Italy, the other is in Spain. And we know that it is maintaining more the biological components and ensuring the microbiological safety. But the practical issues play here. So maybe more expensive for now, and maybe a little bit bigger than the um, older pasteurization. So it has to be improved, I think. Also, there is HPP, high pressure pasteurization. It is being thought, not we need more studies, but maybe better in for Bacillus cereus, but for now it is not practical for the reality, but it is promising. And also new technologies are important, but it's important also to use Holder pasteurization in the correct way, and respecting all the temperature rises and falls in the correct timing. The other thing, that there are very many collecting spots, you told. Well, and you asked if they should be closed, or I think also in some parts it can be kept, but we have to see. I don't know in which part of the Europe this is. Uh, if they don't process the milk, then they will have another name. They are not bank, because according to the definition of the human milk bank, as you know, it is collecting, screening, collecting, and processing, storing, tracking. All these things are being done, and also European regulation adds import, export, release terminology. So these are not milk banks, but depots. We can tell they can be, if they cannot be establishments because they are not processing milk. To close them, I don't have any opinion about this, because I have to know the conditions of the if they need these uh, depots or not. But they are not milk banks, surely.
Okay, but at the moment we don't know if they should be closed or will be closed
No,
or not in the future.
no,
Okay, thank you.
because milk banks will be registered
Yeah.
as
Now,
TC.
yes,
Yeah,
yes,
sorry.
second, yes, it's okay.
Yeah.
Another question for David. David, did you perform some studies on the antiviral properties of colostrum and mature milk, mature human milk? There are differences or not?
Yes, of course. We did many studies comparing colostrum and mature milk. And definitely in our system, in particular with cytomegalovirus, but even with other viruses, colostrum is more potent. And this is not surprising. Probably colostrum has specific immunoglobulins, but also concentration of other antiviral factors like oxysterols that we have discovered in a common research, if you remember, Guido. And so, for sure, colostrum is more potent than mature milk, but mature milk retains antiviral activity.
Okay, thank you. Now another question for Sertac. What do the milk bank professionals in Europe and EMBA members think about this regulation? There are concerns or not?
Yeah, yes, this core question. Yes, of course, there are concerns. Yes, everybody who is in the work of milk banking or on the neonatologists too, of course, or pediatricians who are taking or nurses who are taking care of the babies will want that there is a European regulation or European guidelines. First, we were dreaming uh, to ensure the safety and quality for the milk, for the recipient, for the donor. So they are happy about this, but on the other hand, of course, in the beginning, the concerns were for more commercial issues. So if the milk could be sold, if there will be I am not able to commercialization of the milk. But this in the regulation, also in the EDQM guide, it is very clearly written that donation should be unpaid and voluntarily at a legally with from a legally competent donor. So at the beginning, I was concerned too about this commercializing issue, but not now because I saw also in the regulation it is written clearly. Another concern is if the regulation is very strict, then some small milk banks can be closed. Um, yeah, there is still because the practices are different. So if the regulation can be or the EDQM guide can be good for some milk banks, but not good for others. But I think in this transition period of 3 years, uh, we will keep in touch with our members, with milk banks, and they will come. Also, some of them will be experts in the Imagine project. So we'll prepare guidelines, evidence-based guidelines, and if there is need to change, we will change, of course.
Okay, another question for Professor Lemba. What is the effect of older pasteurization on hepatitis B virus?
Yeah, this is an interesting point because this is the case where we cannot cultivate the virus in vitro, so we don't have the virus to prove directly the activity of older pasteurization on the hepatitis B virus. It's difficult to have the virus and to make these experiments. So I cannot tell you clearly what is the activity of older pasteurization. That's why one of the selection criteria for donors, but you can correct me, Sertac Guido, is the screening for hepatitis B.
Yeah. Correct.
Right?
Correct.
Yeah. Yes. Okay. A question for Sertac. How can traceability be possible when pooling is done? Did you get the question, certain?
Yes.
Okay.
Yeah. Of course, pooling is being conducted in some milk banks to homogenize the nutrient content, but it is possible with the digitalization, of course. If it is difficult if you use many donors, it is difficult, but it is 2-3 donors pooled, and then you with the digital information you go back and find. It is possible, but always it is safer single donor.
So you are in favor of single donor donation instead of pool the milk of
I
many.
am, yeah, but I don't say it should not be done, but I am in favor of single donation.
But pooling is possible. It should be more complicated for the traceability, but it is also possible because there are advantages also from pooling.
For the nutrient content homogenization, yes. Also
Yeah.
to dilute possible contaminants, yes.
Mhm.
But it is possible, of course, tracking, but you have to go back to the origin of 2, 3. More than 3, I do not advise.
Okay, it's a good compromise. Thank you.
Yeah.
So, Serta, it's always for you. What about a human milk-based fortifier? Will it be regulated as SOHO also?
Um, Human milk-based fortifier, if there is in Europe, it can be. I am not sure. It's but it is not written now. It is because one is in America. Yes, also there is in Europe. Yes, but there isn't any. Uh, how can I say, certain point in the regulation, but we can write, we can prepare also when we are supposed to prepare also for this some rules when we are preparing the guidelines.
So at the moment there are
No, at
nothing
the
about
moment, no.
this in the SOHO regulation. No, it
Yeah,
is not considered. Okay.
but we should work on this also.
Okay. Another question for Serta. So which serology testing should be done for hepatitis B for milk donors?
In the moment, there is the there is not now consensus on this. The usual serological testing is being done, but also molecular testing is now recommended for hepatitis B. And David, would you like to
Yeah,
comment
yeah, yeah.
on?
This is what we do in the lab. I'm not aware of the regulation for donor milk, but this is a combination of serological and molecular tests.
Yeah, but in the guide now, it is not very strict for now, but
Yeah.
it is uh, it is recommended a combination.
Okay. Another question for Sertac. Sertac, you mentioned that in a 3-year period, all
Yes.
European milk banks should adapt themselves to the new regulation. As EMBA, do you have any plans to help your members to have a smoother adaptation period?
This is a nice question too. Yes, this of course I'm not telling this. It's written in the regulation that in 3 years all members should adapt themselves. As EMBA, of course, this EDQM guide will help, but also uh, Imagine project will help more, I think, because they can interact with the Imagine project. EDQM guide is more close to a few or not a few, but the group of EDQM and if representatives of EMBA. But Imagine project will have direct contact also with milk banks through the implementation phase. So I think that it can be very helpful in this adaptation phase. They can, if they fulfill the criteria of expert forum, they can be an expert, or they can be stakeholders, our members, or they can be in the expert advisory, external advisory board, or consultants. So we can help them in any way. You can contact them and throughout also videos and training tools.
Okay. Another important question, I think, for Sertac. So you told that in a short time we will have European guidelines prepared by EMBA, and we have world guidelines prepared by WHO. So don't you think that these guidelines can overlap or can be different because the EMBA guidelines will be based on the European situation and the WHO guidelines will be based on the world global situation?
Yes,
What do you think?
this is a very good question too. All the questions are very good today. The WHO, yeah, we have only 18 months to prepare these two sets of guidelines. And of course, we will ask also the opinion of the milk banks, our experts, stakeholders, everybody. But it will be based on European. So we will keep in line EDQM guide, our milk banks requirements or system of working. So the European reality. And only now there are only 17 months, but WHO has a little bit more time and will be based on worldwide requirements. So there can be low tech countries, high economic level countries, all together worldwide. So I think it will be different. But in some points, we will come
Some
together.
points, yes.
Yes.
Yeah. Okay, I don't see any other question, but I think that the discussion has been very interesting. A lot of questions, very interesting question, and a lot of nice answer. So I thank all the two speakers today for this very brilliant presentation. And I would like to conclude this session with showing the last slide. Can I have the last slide, please? Yes. I wanted to invite you to present a paper to this special issue of nutrients that is completely dedicated to donor milk donation human milk banks. So the title of this special issue is The Role of Donor Milk and Human Milk Banks in Promoting Maternal and Infant Health. The deadline for the presentation of manuscripts is 25 February 2025, and you can have all the information related to the issue with this QR code or with this web link. So, thank you for your attention. It has been a pleasure to be with you today.
Thank you, Guido.
Thank you, Guido. Thank you all for your attention.
Thank you.